Hi friends, welcome to Smile Nursing tutorial. How are you all of you? Today we are going to discuss about the tuberculosis. It is a common and often deadly infectious disease caused by mycobacteria. Mycobacterium tuberculosis in humans can affect the lungs but also affect other parts of the body. Next, what are the causes of tuberculosis? Tuberculosis is caused by Mycobacterium tuberculin bacilli. Next, coming to the signs and symptoms of TB. First, coughing that lasts 3 or more weeks. Coughing of blood, chest pain or pain with breathing or coughing. Next, fatigue, weight loss, fever, night sweats, chills, loss of appetite. Next, how to diagnose the tuberculosis? First, this Mycobacterium tuberculosis stained red. In sputum, tuberculosis is diagnosed by identifying the causative organism. In clinical sample, for example, sputum or pus, then go for chest X-ray. Next, mantouxtuberculin skin test are used to routine screening of high-risk individuals. Chest photoflurography has been used in the past for mass screening for tuberculosis. Next, coming to the management. So, WHO recommended that they should have 6 months of TB drug treatment. So, it consists of 2 months intensive treatment and by 4 months continuation phase. For the 2 months intensive phase, TB drug treatment phase, they should receive isoniazid with rifampicin and pyrazinamide and ethambutol, followed by isoniazid with rifampicin. Okay. For the continuation TB drug treatment phase, it is essential to take several TB drugs together. If only one TB drug is taken on its own, the patient will very quickly become resistant to the drug. DOTS. You might have listened this word, directly observed therapy. This is a short course and it is a major plank in the WHO. It's a global TB eradication program. Okay. Next, the DOTS focuses on 5 main points of action. These include to control TB diagnosis based on sputum smear microscopy test done on patients who are actively report TB symptoms. Next, direct observation, short course chemotherapy treatments. Definitely supply of drug and standardized reporting and recording of cases and treatment outcomes. All these come under DOTS. Next, how to prevent the TB? First of all, the people with TB and their contacts are identified and then treated. Next, children are vaccinated to protect them from TB. Next, coming to the vaccines, many countries uses Bacillus Calmette that is BCG vaccine as a part of the TB control programs, especially for infants. What is nursing management of TB? First of all, isolate patient immediately either at home or hospital. Next, teach patient or his relatives how to disinfect and dispose of sputum often an open case and keep his utensils and articles separate. All the contacts must come to clinic for examining the periodical checkup after every 6 months. So, complete rest and well balanced and nursing diet should be given to the patient. Patient diet contains Next, more amounts of proteins and vitamins. The diet should be such that is easily digested by the patient. Patient should not be allowed to live in cold air and have direct draught. Patient must take treatment in time. When the patient is in the hospital, there is not a problem regarding treatment, but when it gets discharged, it is very important. If he doesn't take the medicine properly in time, in such cases, nurse must explain him and to his relatives about importance of treatment. Nurse must see that the patient is properly rehabilitated. Next, she must take all the precautions to prevent herself, her family members, friends from contacting this disease. Thank you for watching this video. Next, we will meet with another video.